All right, I'm excited about today's show. We got a great panel in store for us today. I'm very excited about my entire panel. First of all, I want to thank those of you who are going to be joining us because we know that your time is important. We want to make sure that this time gives you the highest return possible. And I also want to thank all of our guests for being here with us today. So let me start off with who you see on the top left-hand corner of your screen. And I have Mr. Tyson Davis. Welcome to the show.
Thank you for having me.
Excellent. We'll get to intros in just a second. And then I also have Dr. Bonnie Clipper. Welcome to the show.
Hey, it's great to be back, Rollis.
Oh, yeah. Always love having you back. And then we also have Dr. Alisha Cornell. Welcome.
Hello, everyone.
And also we have Dr. Chibu, otherwise known as Dr. Chibunna Nwaobia. Welcome to the show.
Thanks for having me. Hello, everyone.
Thank you. And then we also have Miss Heather Mckenzie. Welcome to the show.
Hi, great to be here.
And those of you who are just now chiming in, let us know what city, what state, what country you're coming in from. Let us know where you are in your journey. Where are you in the healthcare innovation part of your journey? Are you just here to learn? Are you in healthcare innovation? Are you kind of within a project right now? What part of the country are you coming from? We'd love to hear all about you. We want to hear your questions, your feedback as we go throughout this discussion. And as we go along, I'm going to be looking at your comments, and I'm also going to be looking at feedback from our panel as well. So we're going to be talking today about healthcare innovation, how it can enhance staffing, because one of the first things sometimes we think about when we think about innovation, some of us, we think about, are they going to take away my job, or do I have to learn how to do something new? More so than how it can enhance the staffing model. So I do want to get into this, and I've asked Dr. Cornell, Alisha, to assist me as a co-host. So you're going to be helping to ask clarifying questions, and all of us are going to just kind of have this as a free-form discussion as we go throughout this discussion today. So I want to start off with you, Dr. Clipper. I want you to go into what are some things you're seeing from a healthcare innovation standpoint?
You know, nurses have really done an amazing job and stepped up during the course of the pandemic. And so many of their great ideas, they've actually put into practice, developing patents, trademarks, starting businesses at a rate that we've never seen before. So there are a lot of pretty amazing things that have come of this. If you think about it, at the start of the pandemic, we really weren't sure what was going on. It was nurses that were incredibly innovative and learned very quickly to string together multiple sets of extension IV tubing so that they could keep pumps outside of patient rooms while they could adjust the medication, the drips going into the patients. We also had nurses doing very simple but innovative things, such as bringing in their home baby monitors to put inside the patient rooms and monitor them while they're in there. Now what we're actually seeing is nurses that are developing apps around scheduling, trading shifts, trying to become much more intuitive with how they can actually schedule their shift, their unit, or their department. And we're also seeing some really cool things on the scene, such as the gratitude platform that actually starts to build culture to encourage and help create a really positive place for nurses and other employees to spend their time every shift, every day as they work. So a lot of great things going on right now.
I love it. And can you just briefly give us an intro on yourself? And I want to do that with each of you as we give your first answer. Give us an intro on you, Dr. Clipper.
Yeah, you bet. I'm Dr. Bonnie Clipper. I'm the Chief Clinical Officer at Nwaobia. We're a health tech platform that really work to reduce burnout, improve the patient experience, and enhance employee engagement. I'm a top nurse influencer on LinkedIn. I'm an internationally known expert in nursing innovation. And I have the experience of being a chief nurse executive for 20 years as well. So I'm able to have a really robust conversation because I've probably been in the majority of those meetings throughout my career.
Love that. Appreciate that. And so, Dr. Cornell, give us your feedback on what you're seeing from an innovation standpoint too, and then I want us to the rest of our panel to kind of also chime in as well.
Oh, it's definitely the stretch. Since I'm in the SaaS world, software as a solution, usually my clients are actually looking for supportive ways that influence the programs that they build. So always data is used as a huge decision maker, and having to stretch resources from nurse educators, clinical nurse specialists, especially. Dignity has been a client in the past before also. And a few clients in St. Louis too. So really using that, and the way that they have been, I develop a strategy, but to see it stretch and extend it in such a different way, to be able to evaluate clinical proficiency, to be able to evaluate collaboration, how are they communicating in an interdisciplinary way, and using technology and really improving on that. It really takes a lot of critical thinking, a lot of understanding. Number one, I think something that you mentioned before is that being innovative or having something to support your innovation in your health system does not eliminate jobs. It actually is a growth. It actually identifies the growth in roles and how much innovation is actually needed to get these jobs done, not only at the bedside, but from the strategic executive leadership level. Being able to sit in my seat and really look at how we trickle down this information, and at every point in the structure, there needs to be someone who is innovative and who can really expand these programs and really get out of it what we need. There has been I know Bonnie mentioned all of these awesome examples, and then I work with a lot of nurses who have built these platforms or who want to enhance or start to ask different vendors, I want to be on your team. Even if I'm still working at my organization, because I want to make sure that the product that you're developing speaks to nurses and speaks to clinicians, so that we can keep giving optimal patient care, especially during the pandemic, which has been fantastic to see people advocating, stepping up. I am more than happy to step to the side. I love all my colleagues saying, I want to help out. Where do I sign up? And I can give them information to come and help support us over on this side too.
Awesome. Thank you very much. So we have quite a few comments coming in. Charles Carsons, he's coming in from Santa Barbara in California. Welcome. We have Blessing. She says, great panelists. And we also have Kim Ali. I know she's coming in from the Maryland area. She says, hello, everyone. We know Kim Ali. So welcome. All right. So Tyson, what are you seeing from your end?
So, I mean, I think of, the continuing idea of this nursing shortage that's more, forthcoming than anything, and the idea that nurses are moving away from the bedside and moving into areas like research and innovation, which is great in the overall scheme of things, but still patient care exists at the bedside. So, how do we look in the future to kind of help balance those teams to stretch our resources as bestly as possible and still provide great patient care? We saw a lot in the pandemic. This team model kept developing, because you're proning patients, you're taking care of high acuity patients where your licensed skilled nurses are more stretched thin. And so how do we look to balance that out? And so I think as we look at the future and how this is going to progress, how does that team model morph into something that still gives us autonomy as nurses and the ability to practice and provide great, excellent care, but also provide, allow us to expand our capabilities and give care to more patients. And what does that look like? And I think, uses of LPNs is a trend that I keep hearing about throughout the country. How do you increase the use of the LPNs within a team model, and then patient care assistants as well? What do we utilize them and task them to do? I often think, is I's and O's something that we could delegate to somewhere else, where nurses typically are very primary care and type A and controlling people for a good reason, because you want them to be. But, is there something that we could do to kind of help offset some of that balance of work and allow us to still provide great patient care?
That's a great point. And I know in a lot of places, staffing ratios is a really big issue. So maybe we can dive into that. But before we do that, give us a quick intro, Tyson, on your situation.
Sure. Yeah, so I manage an ICU, TCU outside of St. Louis, Missouri for Mercy Healthcare System. So I've been here for about 2 years now and got really into it right as the pandemic started. So it's been a fun 2 years.
Wow. Yeah, that was fun. Okay. How about you, Dr. Chibu? What are you seeing on your end?
Number one is in the area of self-care. With the recent pandemic and everything, people were just like, communication. How do we take care of our staff instead of only the patient? So in my own organization, they were able to to bring in experts that were able to help our staff to heal, to grieve, to come back to work. If we are talking about staff to retention, if they are not, some of them were broken and we didn't know what to do. And so many of them were not even able to come to work. But the area of communicating with them all the time, bringing them experts that talk to them, so many of them lost their loved ones, and, we have to provide an opportunity for them to grieve and come back to work. So I believe that area, even in future, is something that, for nurses, we really need that self-care right there, because I know that in healthcare, we focus on patients, but forgetting the nursing staff or the professionals. So the area of communicating to know how, nurses are doing self-care wise, I think that's very important. And if we continue to do that, we see them returning back to workforce immediately because they are healed. But if we just leave them and focus on, patients alone, and we keep losing people on PTOs, on LOAs, something like that, because they are grieving. And, the hospital, management, they don't care about it. So what I'm seeing is that hospitals now care for their staff, and they are bringing, hiring these, grief experts and people that can support nurses to, get back to workforce immediately. Thank you.
Appreciate that. Very good. And now, how about you, Heather? What are you seeing on your end, please?
Hi, yes, so we are embracing technology in every aspect possible. So in my organization, we support care management in the primary care setting. So as during the pandemic, as offices closed or shifted, we were able to reduce on-site care, but expand more of the remote and virtual type of care using telehealth platforms, exploring wearable devices, exploring telemonitoring, and really leveraging the expertise of the registered nurse and how they can support and care for members in the community without directly touching them. So it's been a fantastic ride, figuring out how we can be helpful in the community when we can't exactly put our hands or that direct touch, but still be helpful and part of an interdisciplinary care team. So we also work with our primary care providers. We have medical assistants. We have the social workers and behavioral health care providers working together to meet the member where they are and care for them, whether they're at the medical center or in the community.
Oh, I like that. Very good.
I didn't get that.
So my
Could you try again?
I wanted to say something, but I didn't. It's crazy. So I got a couple of notes from what we talked about so far. We talked about staffing ratio, things that affect staffing ratio, which like the LPNs. We talked about gratitude. I remember Bonnie mentioned that about gratitude. Showing that in communication. That really boils down to communication. And I know that Chibu, he mentioned about grieving. And so I think that also plays into the communication aspect. And what I caught from Dr. Cornell or Alisha was talking about the implementation of tech, kind of introducing people to feel more comfortable with new technologies. So I'd love to, those are some subjects I would like to kind of continue to drill down on. One of the things that I know has come up in different areas has been staffing ratio. So maybe we can just work with that for a little bit. What are some things that we can see in terms of innovations, maybe new ways to look at things that we can possibly address it, because maybe that's an outdated way of looking at things possibly. So I see you shaking your head, Bonnie. What are your thoughts on that about staffing ratios?
It is completely an out of date, out of touch way to look at things. I think that we've gotten ourselves all wadded up over this thing called staffing ratios. It really today isn't very applicable, right? Because we have the ability to adjust roles, personnel, individuals, training, competencies to meet the needs of patients. So I think that we have to step back, and particularly as nurses, we have to own this or someone else will do it for us. So we have to shape what this looks like. I think we have to make sure that nurses operate at the top of their license. For so many years, as Tyson alluded to, the INO, boy, we fought long and hard to hang on to things like phlebotomy, starting IVs, doing I's and O's, rolling patients over because we had to do a skin check. We've fought long and hard over that stuff. Those days are over, right? We have to make sure we operate at the top of our license, whether you're an advanced practice nurse, whether you're a registered nurse, whether you're an LVN or an LPN. And we have to start going back to team-based models where we can give away all of these other activities that really just are time sucks, right? They're important, but it does not require you to be a nurse, registered nurse, even an LVN to do it. And at the risk of the darts coming through Zoom here, I'm going to say, I think nurses could take care of 10 or 20 patients. However, we have to have an adequate number of well-trained and competent individuals on our teams to support all of these functions that we have to do. We also need to use technology as a force multiplier, as an enabler. We hang on to things that we really don't have to anymore. If we could advance the utilization of EHRs, we can incorporate things like AI. We actually have predictive analytics now that tell us when our patients are going to throw lethal arrhythmias hours in advance. They tell us who's going to be septic well before our human eyes and ears see it. So we have to be the ones that drive this conversation, because otherwise it's going to happen to us. And in nursing, we're pack animals. So we like to gravitate and grumble, whether it's good or bad. And we really do need to drive these conversations. So I'm going to step off my box now, but I think there's a lot of opportunity for us to design and reimagine what nursing looks like before we're forced into a corner.
Wow,
I'm going to cheer. I'm cheering for.
That was awesome. In fact, I think that, yeah, look at that. See that kind of reaction we're getting right there? That was great. So now, Tyson, you're the first one. I think that you're and Chibu, I think you're close enough to where you're already, maybe your mind's already working here. What could we use if we were to get to 10 to 20 patients per nurse? What kind of resources do you see? A nurse would have to have off the bat to some of these normal things that they have to do.
Well, that is not happening in California. That's number one thing. Nobody's getting 10 patients in California.
Because of the laws, right?
I'm the director of acute care unit, yes, and the rule is there. If it is method, it's 5 to 1, and we stick to it, no matter what happens. And if it is telemetry, where I work to, is 4 to 1 ratio. And that's one thing about California here. No matter what happens, I know during COVID, we had to get something, and implement team nursing. But over here, we are all about, even in as much as we are taking care of patients, we're also all about self-care. So it's the ability of a director or the leaders to plan ahead of time. We are talking about retention. We are talking about staffing. Once you plan ahead of time, so you should be able to maintain that, because we don't believe that nurses have to have 10 patients. So where is the quality of care right there? In my own department, it's not happening. They only having 4 or 5 patients, and that's what it is. Whatever we can do, talking about AI, we utilize travel nurses, and at the same time, we know when people are on PTO, we don't overschedule. We know when people are sick, we know how to replace them quickly. So I believe that this is the work of the executive leadership to monitor staffing very well and make sure, like we said, know how many patients they have, use their position control to get everything ready. I don't believe that, I know I'm talking from California perspective, I don't believe that a nurse will have 10, 12, 20 patients. No, that is suicidal. Here in California, I know other places, they have so much, but here we focus on quality of care. And this is a challenge for all leaders to come together, look at staffing, because all these nurses, we are human beings as much. You cannot give what you don't have. You cannot come to work today and tomorrow you won't be there anymore because they gave you 20 patients. So we want retention. We want people to keep coming to work. We just want people to work, because they are passionate about it. Not that they come to work and they retire in 5 years because of long-standing and stress that is attached to that. So this is what I have to say. In here, where I work and in California, it's not happening. And we try as much as possible to staff adequately. If we are not, we can utilize team nursing where we can pair people up, let's say the LVNs and RNs together, but at the same time, give them comfortable load according to California code. Thank you.
Okay, we appreciate that. Now, thank you for that point of view. Now, let me ask you one follow-up question to that. I know the reason why you answered that question is because of the laws in California. They have staffing laws there. Not every state has that. But let's say you were working in a different state that didn't have those restrictions, and we remove that as a restriction. Do you see a possibility that there are certain things that nurses are doing that they don't necessarily have to do that other staff could do that isn't necessarily a nurse?
Of course, yes, I see that. But like we said, I teach in school too, an adjunct faculty. So I know delegation and, roles. So we have LVNs, LPNs, and we also have CNAs. And like, I think Dr. Alisha said it. Okay, there are roles like we have automated vital signs machines now that, can do these jobs quickly, faster. So we have all those. We have centralized monitor techs that look at all our monitors to make sure that nurses don't have to go. If there is any issue, they go there. And we strategize things like, in our patient experience to do bundle care, nursing bundle. You go into the room, you do everything you want to do, knowing fully well that you're not coming there for an hour or so, unless there is something happen. So by the time we utilize those strategies, I believe it can work. So the major thing there is knowing how to delegate properly and how to prioritize your care. And if I work in another state that, they don't have, what we have here, like the Californian law, at least you make it work, make it easy, utilize nursing bundle, utilize, team nursing, and make sure that you take care of the patient. You go in, know what you know what you want to do, prioritize it, and come out so that you don't have to keep going and going and going. It's doable, but at the same time, depending on where you are. Right. So this is, like I said, I still keep referring it to executive leadership to make sure that these nurses are human beings. They are not machines, and right. You still need to have them work all the time. Thank you.
Lisa, you're about to say something, Alisha.
So like in full transparency, what we see now as nursing has evolved. This was how nursing was originally. This was Florence Nightingale, all the theorists. And so my challenge to everybody is, because I'm that type of person, I'm still a professor also, is to really think in depth about what we're saying. I agree with Bonnie and Chibunna also for self-care. So I think it is, and the team modeling that Tyson talked about, is we have to rethink this. Like, the pandemic, unfortunately, brought a lot of people closer to what frontline staffing actually looks like. I have frontline staff. I was on a trauma floor, also staffed at a long-term care facility. I had 10 to 20 patients every night, pushing a med car that I'm small, bigger than me, down, but we did team modeling. And I really relied on my LPNs and nursing assistants and wound care nurses and care management. The first thing I think we have to really, really go back to and think about is how are we educating pre-graduate nurses? Like, it really starts in school, to be able to take all of the things that we now know, technology, the whole self-care, how to utilize every other care position that we actually have, to say they are practicing at their scope of their license also. So we don't have to do every single thing. We don't always have to be the managers of physical therapy, because we have doctorates of PT now who come down, and they have PTAs and OTAs who can assist with that type of care for our patients, and really thinking about why is it that the nurse is held responsible for every single action of the patient care model, but we have all of these people that we could work together with to take better care. We have EHR, we have technology, we have all of these other platforms that collect data, but if everyone would actually if it was okay, and I think executive leaders are pushed back. So behind executive leadership, there's healthcare policy, and behind healthcare policy, there's legislation. So all of those things help create these barriers where we come down and we have grumbling nurses who say, "There's no way in this world I can possibly take care of 4 or 5 patients." There isn't when you have to take care of every single aspect of it. We're not sharing the care. This is something that has to be shared. And I still have colleagues who are on the front line now, ICU. These are very extremely critical patients who have COVID-19. And it takes more than 2 nurses, sometimes more than 3 people, more than 4 people, 5 people to provide care to a single patient. And I think it's forcing us to have these debates. And I love that everybody is here on this panel, because what it does is it brings to the forefront of look at how expansive this matrix of healthcare has become. Mm-hmm. And it is definitely time to rethink models of care. And also, not for nothing, self-care is about you. I have to choose when I need to rest. I have to choose that I drink water. I have to choose that I want to be a healthy person to provide this type of care for that. And a lot of organizations that I work with now are saying, yes, we are going to give you self-care. Yes, we have EAP. Yes, we have free therapy. We have all of these, and you still have to take advantage of it. You as a person, you have to do it, because one thing that I always stand by is when we get trained to do these jobs, we signed up. This is what happened. We signed up for this type of frontline work. You signed up for the pandemic, you signed up for this, and using this area and opportunity for innovation. I see innovation across this panel in every aspect of healthcare possible, from the most impactful clinician to all the way down to an environmental services or dietary, and all these people that it takes to actually get hospitals up running and to stay above the water to take care of these patients. It's a lot. It's intensive, and it's a lot of work.
Speaking of that, I think it's time for a water break. We're about halfway through. So if you got some water, this is where we usually about halfway through, we take a little water break here. Now, I feel so much better. That was good. I learned that from one of my guests not too long ago. We have to take a water break. Anyway, Tyson, from your perspective, I want you to give some feedback on what you've heard. What adjustments could you see from where you're standing that could kind of adjust the model? Even if we did a 20% increase of the RN, the nurse being able to care for more because they have the support they need. What are some things you can see that maybe an RN doesn't need to do that perhaps another staff member could do to help them to, expand their expertise, if you will?
Yeah, I think kind of Alisha, everybody's kind of hit at points of it, but legislature is a big piece of it, and the advocacy of nurses really needs to build, because a lot of times we are charting to save us legal issues on the back end, and they are average everyday tasks that we're doing, and we're doing thoroughly, and they don't need to really be addressed, but we are charting them and documenting them. And a lot of times nursing time is spent less with the patient and more on documentation, and we continue to throw a lot more documentation on top of that just because of the legal environment. And so I think that is a very large opportunity to free up a lot of time for nurses, because most nurses want to be physical. That's why they got into this, this profession, to be on the physical end. They like working with patients. They like to heal people. They want that healing touch. And so I think charting is a big opportunity to that. But, the environment and the legal system is kind of always inhibiting that on the back end. But like Alisha said, with PT, with OT, with bedside care, respiratory therapy, all these other professions that are licensed, that have their doctorate level, master's level trained, but yet it all still falls on the head of nursing if something wasn't done. And it's some, because truthfully, as in management, you need that one person to hold accountable, right? You ultimately need that person. But in reality, it really needs to be delegated throughout the other professions. And that would be a great opportunity to help open up the gate for freeing of time, for the ability for us to expand our capabilities. I don't think we're ready for 10 to 20 patients yet in the current environment, definitely not. But I do think, if we look to leverage other professions as well as kind of figure out what is priority when it comes to nursing care, what do we really need to take control of, I think there's an opportunity to kind of advance that.
Yeah. So, okay, one of the things, just based on what you just said, I'm curious. You said other professions, like it seems like to all fall on nursing. What other areas are you talking about that should be sharing the responsibility?
Well, as Bonnie kind of mentioned too, you have diabetic educators, you have wound therapy. Do we really, as the bedside nurse of primary care, when you have a wound therapist involved, which is another licensed or registered nurse, do you really need to do that full wound assessment, be documenting changing gauze every time? And I know California, it is a little different as far as where that lies, but here we have designated kind of subgroups of specialties that we could really kind of relinquish some of that responsibility to, and they're stretched thin. They don't have the full capabilities to do that right now, but can we work to build that and kind of bring that responsibility off some of the bedside nurses, so that if you're at bedside, you're managing ABC, airway, breathing, circulation, and you're focusing on the primary, organ groups and everything that encompasses that, it might be a possibility.
That's an interesting thought. I like that. And I know Alisha even said, she talked about PT as well. That's another area that maybe the nurse doesn't need to be responsible for. Okay, Heather, what are your thoughts on this?
Oh, so we're dealing with this on the ambulatory care side as well. From a care management perspective, the registered nurse is in charge of the interdisciplinary care team care plan. So it's not just about the nursing interventions that we support our patients, but it's also keeping track of all of the barriers to care and other issues, maybe non-medical, maybe there's social determinants of health, maybe it's substance use disorder or mental health disorders. That is our job, to collect that information and put it on the care plan and track it and make sure that other disciplines are completing their interventions to get to the overarching patient goal to meet that. But the other thing I'm seeing on our side from a nursing perspective, and I hate to admit this or put it out there, but there's this distrust. There's this lack of trust that if I do delegate, even to a peer or a colleague in a different discipline, that it will get done. Or if I have to delegate to an unlicensed personnel, that they actually have enough training or understanding to do the job at the nursing level and do no harm. So it's interesting times, interesting conversations I've been having with other nurses about, well, if they don't have a license, then I'm not going to delegate. It won't be done in the same way in which I know, and it causes more harm. And that's where, I do have the conversation about, it's on you then as the delegator to provide that additional education and support, because in this case, if you teach now, you'll be able to delegate in the future. You won't have to spend the time. So invest now for the future, so that if you do need to expand your caseload or need additional eyes and ears to support the care plan, you have your workforce in place. And so in ambulatory care, it's more about working with community health workers at this point, working with the medical assistants in really extending the reach of the care team in the community.
Okay, very good. Appreciate that. I'm going to just point my attention. I had a couple more comments came in. Kim Ali, she said, yes, replenish your cup first so it can overflow to others. Blessing says that is key, Dr. Chibu, reaching out to the healthcare providers. LinkedIn user, it says, this is great panel, Rollis. I don't know who that is. That might be Daya. I wonder if that's Daya who's watching. Jenny, yes, welcome, Jenny. And Kim says quality of care will be compromised. So I think she was talking about maybe the bigger responsibilities. Blessing says self-care is key. Okay, so what I want to do is I want you to button up this this subject before we go into our next subject, Bonnie, because you got some clear. I know you've got some answers. We've had discussions about this before. So give me your responses to some of the things you heard. I'm interested to hear that.
Yeah, it's not an either or. It's an and, right? T plus T, technology plus the team. So this doesn't say there's no one else in the picture to help. A good example is RPM, remote patient monitoring. We're going to see more and more of that as hospitals and systems around the country are already purchasing and adopting the technology that will be in inpatient rooms that allow direct continuous observation of patients to see if patients are having any signs of distress or any issues going on. The person on the other end of that, it's a little bit, as you can imagine, like a flight controller, right? They're looking at a bunch of patients on panels, but they're watching those patients and essentially assessing those patients. Are they in distress? Are they on their call light? Is there something that person can help with? They also can do teaching, pre-op, post-op, medication, discharge teaching. So there is a lot of work already going on in this space to move us there, but it isn't either or. And of course, we would never put patients in a condition where we would jeopardize them or their safety, nor would we do that to a nurse, right? So it's going to be evolutionary in its making, but we have to reimagine the way that we provide care. The models that we have, they're old models and they don't work anymore, particularly as we struggle with nurses leaving the profession at a very high rate. We're on track to hit 30% nationally this year. And we continue to say there's a shortage, but really what we have is a redistribution issue, right? We have lots of nurses in some states. We have a dearth of nurses in other states. So as we manage through this, since we can't make nurses out of sticks and mud, we're going to have to be the ones to drive this. And having been in nursing for 33 years, I've seen the shortage 15 years ago where the AMA was very happy to step in and solve it for us. So we have to own this and figure out new ways to deploy nurses and to create our team so that with technology, we can provide the care that we all want to provide. They're not mutually exclusive.
Very interesting. Okay.
And I want to add something right there. If you want nurses retention, self-care is the key. If you have asked yourself or other people why nurses are leaving, is that piece right there, that's self-care. Some of them are not being heard. If you keep walking them and walking them, they will be tired and they will leave. So that self-care piece is what every leader should really look into and take care of. That somebody is agile, like Tyson, and is walking and walking. If you keep walking him, guess what is going to happen? He's going to get tired on time. So that little piece there is what is important, irrespective of everything that we are doing, communication, transparency. And Rollis, I just wanted to add something here. When you talk about holding people accountable, other people like the PT, the OT, how many times do we hold them accountable? How many times do we go back to see their charts and what they need to do? In my own hospital, we hold them accountable. We said, okay, this is your job. This is your job. Like Tyson, you mentioned about wound care. We have a wound care nurse, and whenever there is a wound, so my nurses, we call the wound care nurse right away. And the wound care nurse that is in-house will come and take care of it. So it's ability to delegate. You as a leader, how do you monitor this delegation? How do you hold people accountable? There are some people that are leaders, they don't even, there is no presence, there's no leadership presence. If you are just there putting on suit and tie, and you don't know what is happening on the bedside, that is where you see a lot of burnout. That's where you see a lot of issues, chatting or no chatting. So if you are right there and able to hold people accountable, you will see people will smile and relieve, and they will, embrace that passion to work as a nurse. And I'm telling you, this is why people are just like going into business, leaving nursing because of the burnout right there that we are not discussing or deliberating collectively, not only nurses. We have to do it with the multidisciplinary team. I just want to add that right there. Thank you.
Okay, very good. Okay, so we're just gonna have a little fun here for a second. Okay, let me diverge here for a little bit. So who's gonna take my first question? Who's gonna volunteer? Let's have a brave one here. Okay, Alisha. So would you rather have a photographic memory or extrasensory perception?
Oh, come on, Ross. Oh man, a photographic memory.
Okay, why is that?
Because I kind of already do now, and I like it, and I like to have that experience and to be able to recall the information super fast. I like that. I just like to be able to have my eyes take a picture of what I need to remember. So when it's time to recall it, that picture just gives me, it's a healthy trigger for me. Like, what does that really mean to me? And to be able to have that information there. So it helps me have knowledge as power and to be more prepared and more available and staying in the present. So right. I would like that.
Is anybody on the other side? The ESP side? Is everybody on the photographic memory side? Okay, so we're going to move on then. All right. So I have one other question for one of you brave ones here. This is a fun one. And so who wants to take this one? Okay, Tyson.
I'll jump in, yeah.
You're going to answer this, and we're going to guess the answer. Okay? So, never have I ever said, that's not how you do it, let me show you. So, we're going to guess whether you've ever said that or not. So, Heather, what do you think? Do you think that he has or he's never said, that's not how you do it, let me show you?
Is this at work or at home? I don't know. That's the other question, right?
At work.
I'm going to say IV line insertion.
Well, no. The thought is, do you think he's ever said that to someone else? Do you think he's ever said?
Yeah.
Oh, so you're
about
saying
IV line insertion.
But you're saying what he actually said. Oh, wow. Yeah. I wasn't following. Okay. All right. Okay. That's a good one, Heather. Okay. So, Chibu, what do you think? Do you think he said that or he's never? By the way, Heather, have you ever done that?
Yep.
Okay. Chibu, what about you?
It's 50-50. He has said, let me show you how to do it, but he has never said, that's not how to do it. I think he's
Thank you, Chibu. Yeah, thank you.
Okay. So have you ever done that, Chibu?
Me, I've told people, let me show you how to do it, but I've never told them that's not how to do it.
Oh, okay. So, all right.
Let me show you how to do it faster, or let me show you how to do it better. Not you. This is not how to do it. Something.
Okay. Alisha, how about you?
Oh, yes. I have said no. I worked on a trauma floor. So I was pretty much like, look, that's not how you're going to do it. This is what's going to happen when you do it like this. Let me show you how to do it so that it doesn't happen again, because I don't want to deal with what happens when you do it the wrong way.
Bonnie, how about you?
Oh, I've absolutely said that. And I'm thinking I've been a nurse long enough that way back when those conversations were with residents in July.
Okay. Wow. That's powerful to do it to a resident. Okay. So Tyson, we're all in suspense. Have you or have you never said, that's not how you do it, let me show you?
Oh, definitely. We've all precepted nurses, that's kind of how you go about it. Definitely when it comes to trying to unclog a G-tube and you're really working it and it's just going to blow up, but yeah.
Okay, very good. Okay, so I cannot believe how time has flown by. By the way, Kim is laughing at us. She enjoyed those fun questions. Okay, I wanted to talk about communication and showing gratitude. So Bonnie, do you want to kick us off on that, and then you guys can chime in as you wish.
Yeah, Rollis, thanks. I think to what Chibu's point is that we have to change the workplace culture as well, right? We have issues in nursing, not only because of our patient care models and because of the supply and demand issues. The other thing that's really very heavy in our hearts is with the work environment and the workplace, the way we treat our colleagues, the way that we care for ourselves. And there are some really simple ways to do that. I mean, we at Nwaobia, we have this amazing platform, but we make gratitude easy because the simple things like thanking people for their help, thanking someone for running and picking up something from the pharmacy or grabbing your late meal tray for you or helping you flip a patient. Those are things that when we're busy, we don't always do. And that goes a long way, right? Now, that's not to say that saying thank you to 10 people a shift is going to keep your staff from leaving. It's not. But you have to start with culture. And it takes all of us in a culture. Leader is extremely important, yet it also takes the team. If you have an amazing leader but a toxic team, it's not going to counterbalance. It takes everybody that believes in the mission, the vision, the value, not only that they bring, but the value of their work. And when you can create a positive work environment where everyone is respected, all voices are heard, people interject, give their suggestions, and can share their input, that's a pretty powerful place to work. Because it is really important to listen to everyone and be part of that conversation. So I think workplace is huge, and we got to stop bullying each other. That is a middle school behavior that has been around since Florence Nightingale, I think, and it is still crazy prevalent, and we need to stop it.
Absolutely. Chibu, I know you got something you want to add. You were talking about self-care earlier, so how does gratitude play into that?
I didn't know I would have won the t-shirt. I have a t-shirt says always thankful, and every Thursday, so we have what I implemented called Thankful Thursday. So that Thankful Thursday is an opportunity to show gratitude to my staff. So we buy them food or stuff every Thursday, and we like them, when they come to break room, we start asking them what they are grateful for. Just a way to shift from complaining to being grateful. And if you ask my staff, they will tell you that. So that Thankful Thursday have gone a long way. You see so many people crying. Oh, I'm thankful for my job. I'm thankful for my family. And guess what they do? They use that to go back to their patient and say, we know that you are hurting, but today is our Thankful Thursday. We are showing gratitude. What are you thankful for? Every Thursday in my job is Thankful Thursday, and we have a t-shirt that says always thankful. And in my unit, we always say that we are the second best place to be in the world. The first place is Disneyland, and the second place is my department. Yeah. So honestly speaking, if you ask them, they will tell you that. And why? It's just to bring them in. It's just to make them happy, to work, to give them that sense of belonging. That's number one. Another thing is transparency. Whatever we want to do, my staff will tell you, I will tell them, this is what we can do. And if I go to fight and I didn't get it, I still come back to them and say, hey, I've gone to the top management to fight for this. It didn't happen, but this is another way to do it. So as long as they know that you are present with them and that you are transparent, you are communicating, and you are showing gratitude, let me tell you, it's going to be very easy. The other day, they told me something. They said, Chibu, you brought management to us. Before you, we didn't know what management was. And they weren't coming, but with you, and you brought it. Guess what, guys? I hike with my staff. Every Friday morning, I said, hey, let's go. Those that are free, we go, even with my managers. And we come back, we take pictures. And, we have a group me, and we put it there. Weekends, and, we bring things together. Make people feel like they are a family. So we call ourselves ACU family, which is acute care, unit family. So those things, don't just work as if you are, because you have a title. I used to tell them minors, being a director, I'm still a nurse, I'm still one of you. Just make them feel homely, right? Give them that sense of belonging. They will appreciate it. They will come to work, not just for the money, but to take care of patients. And honestly speaking, this is who I am. And this is what I've been, going around to preach, because I love self-care. It's very important. If you want nurse retention, see, people enter nursing, I don't know, for the passion. They just want to help. They just want to love. They just want to have that helping hand. But if they come and the reverse is the case, they tend to leave. So this is what I've been doing in my own little corner. And I can tell you that it's been working greatly. Like my retention is just like that. So
Awesome.
This is what I can encourage other leaders to do too.
So this is what I want to tell you for that, because that was a great little piece there. You mentioned about thank you. So I'm going to tell you thank you.
Yeah.
Thank you.
Thank you.
So what about you, Heather? What have you seen from your end in terms of gratitude, communication? Has there been any innovations or improvements you've seen in that area, and how it can enhance staffing?
Oh, absolutely. And it's an ongoing commitment and an ongoing continuous improvement effort. I know within our organization, you can never over communicate. And, constant and consistent, I think, are key. And finding different ways of doing that. So I know for me, departmentally, it's not just at meetings, it's not just the emails, but trying to work on video recordings, especially since we're now in an environment where we're a little more asynchronous, and we need to get the message out, but the nurses, the other care team members may be busy caring for the patients, so when they can find time to focus and receive communication, trying to use different methods is what we're all about, as well as these fabulous communication platforms that are now available, whether it's Fuse or MS Teams or even Zoom at this point, and really using the text feature, not only for staff, but also embracing that with our patients as well, to stay engaged. And it is really not just about communication, because a lot of times it's one way, maybe two way, but that true level of engagement and dialogue. So you're listening, you're learning, and you can improve.
Oh, I love that. I know Bonnie's company, they do a lot when it comes to communication. So be sure and follow her, guys. Those who are watching on the comments, when it comes to that, she's got a really cool app. If you watch one of my older videos, in fact, Bonnie was she's one of my first episodes. I say probably the first 10 or so episodes, and she dealt with a little bit of technical difficulties with me that day. I remember that day. So I got to give an extra thank yous for you, Bonnie. You were there early.
Yes, and I'm even back.
And you came back, yes. She's been back on several. I think you've probably been on 4 or 5 shows at least. Yeah, which you're amazing. Anyway, Tyson, quick thoughts on communication, because we got to wrap up here pretty soon. So what's your thoughts on communication within your unit? How are you handling that? What are some innovations you've seen or improvements you've seen in that area, and how it enhances staffing?
Yeah, I just think thinking of non-traditional ways to communicate. I know everybody, my team kind of primarily used Facebook and then we got away from that, and now we use kind of a band app or a way to push out mass communications at once, but being flexible, because not everybody communicates the same way. So it's finding multiple avenues that are easy to post to, because sometimes it's very hard to remember what message you put where, but not everybody's going to the same place for information. And, email is, you put it out there, but it's sometimes late before your coworker who only works 3 days a week comes in, and then at that point it's outdated information. So I think multiple modes of communication. When we think about communication, I always think flexibility. Night shift coworkers, day shift coworkers, they all want to communicate at different times, but having that openness and flexibility to be able to maneuver things around to make it work for them as far as their schedule goes. I know Bonnie had talked about scheduling, apps and different ways to trade schedules, but I think that's huge, and not being so rigid in our 7 to 7 thinking that we've always been for a long time in nursing, trying to find ways to be flexible with that.
Oh, appreciate that. Yeah, absolutely. Okay, so as we're wrapping up towards the end here, I did want to try and just address this. Whenever this new tech comes in, whether it's AI or if it's robotics that's coming in and doing certain simple tasks, one of the first things that staff will think is, oh my gosh, am I going to lose my job? What am I going to do? Do we need less of people like me? So I would like each of you to pipe in on what are some things we should think about if we're that worker, if that worker's watching right now, or if we're a leader. You can come in from either direction, making either side feel more comfortable with this technology coming in. Alisha, do you want to start us off?
Oh yeah, for all of my clients, really what I try to help them understand is what my role is. And I use a couple of different virtual collaboration ideas and engagement, because what I do is I have it so that it is their idea, so that their confidence is up, their courage is up. It's not my idea, it's your idea. And I think anybody on the other side, on the opposite side, should really think about it as, this is my opportunity to use my voice. This is something that I can create, I can own, and it's something that I will be responsible for, not for a promotion, not for extra money. But if you don't like the way things are going, this is your opportunity to take charge of that. And there's a thing, a startup. I feel like a startup can start up anywhere. It's your startup. If you think about it as yourself, this is your startup. This is what you want to do, and you are in charge of it. And that's the way I come at it. And I would, give that advice to my colleagues, is that it's okay if you don't know, because we'll learn together. And it's even more okay that you actually want to take on something that somebody else doesn't want or isn't doing right now, and make it your own.
Appreciate that. Heather? Really brief.
Yeah, so my advice is embrace it, because, the jobs I hold today weren't even thought of 10, 15 years ago. And, to be flexible and go on the journey, because it will take you and grow you, and you'll be doing some exciting things we can't even, think about now.
Awesome. Chibu, very brief, please.
Yeah, I kind of like that, to go with it, because it will, technology will always help us. Like, we can't get enough of it. We cannot get enough of it. There are so many things in the hospital that ordinary manpower cannot finish, like watching multiple, fall patients. So with this kind of technology now that helps us to watch, watch 16, 15 patients at once, that helps us. And it frees our CNAs to do other things. So embrace it, because we can't get enough of it. Thank you.
Awesome. Thank you. And briefly, Tyson?
I think from my perspective, you'd rather be part of the change than experiencing just the downfall of it, and the decisions made with you not involved. So, you'd much rather be at the table rather than on the menu, kind of thing.
I love it. That's a clip right there. Thank you very much. By the way, Blessing says, oh yeah, we've really got to stop bullying. So I remember we mentioned that earlier. I think that was Bonnie mentioned earlier. And one other comment I want to just highlight. Kim said, gratitude makes you appreciate what you have instead of focusing on what you don't have. Thank you for that. Appreciate that. And Dr. Chibu, they said to keep it up. They loved your leadership you're showing with what you were doing. So Bonnie, can you wrap us up? What's your thoughts? Your thoughts to bundle this up briefly.
Absolutely. To amplify what everybody said, I think it's important to be ahead of the change curve, to be a part of it, to be involved. Otherwise, you will be left behind. So tremendous opportunity for us. And certainly, I do not see nurses or many healthcare professions out of a job due to robots anytime soon. Awesome.
Appreciate that. Well, I know that our audience is excited about today's discussion, because I'm already seeing some of the reactions already. From all over, which is great. We love to see that type of feedback from our audience. So I want to thank you on behalf of our audience that are all over the world, actually. Thank you for your time that you spent with us today, because really these types of discussions help to move things forward. So I want to thank each of you for your time today. And what we'll do right now is we'll go ahead and say bye to everyone. I want to ask you guys to stay on for just a moment as we wrap up the stream. But bye, everyone. And also, please make sure you put in the comments what resonated with you today. What is it that you liked about the discussion today? And we'll be looking at these later. Each of us are tagged in this discussion. By the way, folks, is it okay for them to if they want to connect, to use the connection that we have at the top there? Okay. So they're all connected. They're all tagged at the top of this. So feel free and connect with them directly. So thank you. Let us know when it's okay to cut the stream, Jonathan. And by the way, as we're waiting, Leah says, great show today. And Blessing says, absolutely a great show. Glad I joined. Hopefully we get to embrace this change. Excellent. So thank you.
You're good, Rollis.
Okay.